If you think the safest way to take a pill is to toss it back with a tiny sip of water right before bed, here's what most people get wrong. After 65, that ordinary habit can become a real hazard. In one swallowing study, a pill cleared in about 5 seconds when people were upright. Lying flat, it took about 23.6 seconds. Remember that number, 23.6, because every extra second is more time for a pill to stick, dissolve in the wrong place, burn the lining of the tube to your stomach, or hit your body harder than you expected. That is not a small number. This is not just about a little discomfort in your throat. This is about bleeding, ulcers, choking, missed doses, drug interactions, falls from dizziness, kidney stress. And over time, it is about something even bigger than that. It is about whether you stay steady on your feet, whether you keep your independence, whether you can trust the medicines that are supposed to protect your heart, your bones, your blood pressure, your thyroid, your memory, your future. Because if you take the right pill in the wrong way, you can still get the wrong result. I'm a physician, and I've spent more than 15 years caring for older adults in clinic and in hospital rooms, reading the research, reviewing medication lists, and helping patients sort out problems that looked mysterious until we slowed down and looked at how the pills were actually being taken. And let me be clear, I'm not here to sell you a supplement or scare you into a course. I'm here because this is one of those quiet health risks that gets missed every day. People are handed a bottle, given a quick instruction, and sent on their way. Then months later, they are dealing with chest pain, nausea, dizziness, weak bones, bad lab results, or a hospital visit. Nobody saw coming. Stay with me until the end. Because one of the most surprising dangers on this list is not a rare drug at all. It is a breakfast-at-table mistake involving a common pill and a common mineral. And I have seen it throw off treatment for months before anyone catches it. And before we go further, tell me your age in the comments, or tell me how many pills you take in a normal day. 1, 3, 7, 12. I read every single comment, and those numbers help me understand what this community is dealing with in real life. Before we get to the list, I want to give you 3 simple ideas to hold in your mind. First, transit. That just means movement. Think of your esophagus like a soft hallway from your mouth to your stomach. A pill is supposed to slide through that hallway quickly. If the hallway is too dry, or you lie down, or you use the wrong technique, the pill can get stuck along the wall like a wet piece of paper on paint. Second, absorption. That means how your body takes the medicine in. Think of your small intestine like a loading dock. Some pills need an empty dock. Some need food nearby. Some cannot be parked next to calcium, iron, or certain juices because the wrong neighbor blocks the delivery truck. Third, interaction. That means one thing changes another. A drink, a supplement, or a second pill can make a medicine much stronger, much weaker, or much rougher on your stomach and kidneys. Think of your liver and kidneys like your body's filter and traffic control center. Overload them, and problems start stacking up. Keep those 3 words with you. Transit, absorption, interaction. We're going to come back to them over and over. Number 1, dry swallowing or using only a tiny sip of water. Here's what it does inside you. A pill is not a pebble. It is a chemical package. If you swallow it dry, or with one nervous little sip, that package can hang up in the esophagus instead of getting to the stomach where it belongs. Think of your esophagus like a water slide. If the slide is dry, the rider does not glide. It catches. And when a pill catches, two things can happen. 1. It hurts. 2. It changes where the medicine starts dissolving. That is how people end up with burning, chest pain, a stuck feeling, or a sore throat they think is heartburn. In a study out of the University of Queensland in Brisbane, researchers looked at 152 adults and found that 32% said they currently had trouble swallowing tablets or capsules. About 1/3 had cut or crushed a medicine at some point just to get it down. That tells you this is not rare, and it is not trivial. Let me tell you about someone I'll call Margaret, 72 years old, from Columbus. She took her morning pills dry because she did not want to fill up on water before leaving the house. By late morning, she kept getting a hot scraping pain behind her breastbone. Her first thought was reflux. My first reaction wasn't fear, it was frustration, because I had seen this pattern before. We changed one thing first. A full glass of water with every pill, one group at a time. Sitting upright, within days, that raw, burning feeling eased. So what should you do instead? Use plain water. Not coffee, not juice, not a spoonful of yogurt, unless a clinician specifically told you to use a soft food. For most pills, take them with a full glass of water. If you are on a fluid restriction because of heart failure or kidney disease, ask your own doctor or pharmacist what amount is right for you. But do not make up your own just a sip rule. Take the pill, then take a few more swallows after it. Give it a clear runway. And here is a synergy tip. Pair this with number 2. Water helps, but water plus posture is what really protects you. Number 2. Taking pills lying down, reclined, or right before sleep. Here's the part that should concern you most. Gravity is not optional. Think of gravity like the helper hand that guides the pill down the hallway. When you lie flat, you take that helper away. A biomagnetic swallowing study of 14 healthy adults found that in a fully upright position, the average transit time was about 5.2 seconds. At a 45-degree angle, it was about 6 seconds. Lying flat, it jumped to 23.6 seconds. That is more than 4 times longer. More than 300% longer. That is not a small number. And clinical guidance on pill-related injury is blunt about this. Pills should be taken upright, with a full glass of water, and not immediately before going to bed, because older adults are more likely to develop pill-related irritation and injury. Let me tell you about Robert, 78, from Tampa. He kept his evening medicines on the nightstand. He would already be under the covers, prop himself up on one elbow, swallow everything, and go right back down. He described a sour taste in his mouth and a sharp pain. When he swallowed toast the next morning, the room smelled faintly of menthol from the chest rub he used every night, and he assumed the pills had nothing to do with it. They did. The consequence of ignoring this habit is not just discomfort. Some pills can irritate the lining of the esophagus. Some can sit there long enough to cause real inflammation. Others may simply not move well, leading you to think you have a swallowing problem when part of the problem is your timing and position. So what should you do instead? Take pills sitting fully upright, not slouched sideways on the couch, and not half flat in bed. Then stay upright for at least 15 to 30 minutes after swallowing. And for certain medicines, especially bone medicines like alendronate. That upright window matters even more. In a large study of 1,028 patients using weekly alendronate, researchers tracked medication use errors and still found that some patients failed the upright rule after dosing. That rule exists for a reason: to protect the esophagus. If it is bedtime medicine, move it earlier. Put it next to your toothbrush or dinner plate, not your pillow. Number 3. Using the wrong swallowing technique for the kind of pill. Here's what most people get wrong. Tablets and capsules do not behave the same way. A tablet is usually heavier. A capsule often floats more easily because of the shell and the air it can trap. Think of a tablet like a small stone and a capsule like a tiny fishing bobber. If you use the same head position for both, one of them may fight you. A peer-reviewed study in the Annals of Family Medicine tested 151 adults in the general German population. For tablets, the pop bottle method improved swallowing in 59.7%. For capsules, the lean forward method improved swallowing in 88.6%. Read that again, 88.6%. Here is what that means in plain English. For a tablet, place it on your tongue, seal your lips around a bottle opening, and swallow with a firm drink from the bottle. The suction can help move the tablet cleanly. For a capsule, place it on your tongue, take a sip of water, and then gently tip your chin forward before you swallow, because the capsule tends to float. Leaning forward can help it move toward the back of the throat more naturally. Let me tell you about someone I'll call Elaine, 69, from Phoenix. She said, "Doctor, I can swallow food just fine, but those big capsules sit there like marbles." She would throw her head back every time. That sounds logical, doesn't it? But it was the wrong move for the kind of pill she was taking. We switched her to the lean forward method for capsules, and she laughed at the next visit because, as she put it, that silly trick worked better than all my worrying. The benefit here is immediate. Better transit, less fear, fewer skipped doses, less temptation to chew, crush, or give up. So what should you do instead? Match the technique to the pill. Tablet, pop bottle, capsule. Lean forward. Practice when you're calm, not rushed. And if a pill still sticks or frightens you, that is not a character flaw. It is information. Bring it up. Number 4. Crushing, splitting, or opening pills without asking first. This is one of the most common mistakes I see, and it is understandable. A pill is hard to swallow, so someone thinks, "I'll just cut it, I'll just crush it, I'll hide it in applesauce." Sometimes that is perfectly safe. Sometimes it changes the drug completely. Here's what it does inside you. Think of some pills, like time-release containers. They are built to open slowly, over hours. Crush that pill, and it can hit your body all at once instead of over the whole day. Other pills have a protective coat, so they do not irritate your stomach. Also, they do not dissolve until they reach the intestine. Split that coat, and you change the map. Back to that University of Queensland study of 152 adults. About 32.5% said they had cut or crushed a medicine before swallowing it, and nearly 47% said someone else had crushed medicine for them at some point. That is a huge clue that swallowing problems often lead to unsafe workarounds. Let me tell you about Tony, 74, from Newark. He had started crushing a long-acting pill because it was easier to get down. He did not do this to be careless. He did it because nobody had shown him another option. Within days, He felt washed out and lightheaded, in a way he had not felt before. When we reviewed the bottle and switched him to a form that was actually safe for him, the problem settled. The consequence of ignoring this is simple. The right dose becomes the wrong dose. So what should you do instead? Ask one direct question every single time. Can this pill be crushed, split, chewed, or opened? Ask your pharmacist. Ask your doctor. Read the label. Extended release, delayed release, enteric coated. And some capsules often should not be altered. Not always, but often. If swallowing is the problem, there may be a safer version. A smaller tablet, a liquid, a dissolvable form, a patch, a different schedule, or a different medicine altogether. And if this is already opening your eyes, subscribe and share this with one person you love. A lot of seniors do not need more noise. They need clear truth. Their appointments do not have time to cover. If this kind of plain talk helps you, pass it on. Number 5, taking a whole handful at once. Just because your list is long. Now we need to talk about pill burden. Here's what it does inside you. Think of your medication schedule like airport traffic. Some planes can land together, some cannot. Some need an empty runway. Some need fuel on board, which means food. Some cannot be near each other because one blocks the other. When you throw everything down in one sweep because it feels efficient, you may be creating quiet collisions. Using CDC survey data from the National Health and Nutrition Examination Survey, researchers analyzed 55,081 adults and found that among people 65 and older, polypharmacy, meaning 5 or more medicines, rose from 23.5% to 44.1% over the study period, nearly half. So if you feel like your pill routine has become complicated, you are not imagining it. The system really is heavier than it used to be. The danger here is not just forgetting a dose. It is timing errors. It is taking a stomach-irritating pill with an empty stomach when it should have been taken with food. It is taking a pill that can lower blood pressure right next to another one that does the same thing. Then standing up fast, it is burying a thyroid pill next to calcium, or a blood pressure pill next to grapefruit juice, and wondering why the numbers do not make sense. So what should you do instead? Do a brown bag review. Put every prescription bottle, every over-the-counter pill, every vitamin, every herb, every powder, every chewable, every sleep aid in one bag. Then review them with your doctor or pharmacist. Make 3 columns. Empty stomach, with food, separate from other pills. If you take 5 or more medicines, this is not being fussy. This is basic safety. And here is the synergy tip. Number 5 is the umbrella over numbers 6 and 7. Once your schedule is organized, dangerous pairings become much easier to spot. Number 6. Washing pills down with juice instead of water. Especially grapefruit juice. A lot of people assume that if a drink is healthy, it must also be a good pill partner. Not true. Here's what it does inside you. There is a group of enzymes in the gut wall and liver that help break down certain medicines before too much of the drug reaches your bloodstream. Think of those enzymes like chemical scissors. Grapefruit juice can gum up the scissors. In a clinical trial from London Health Sciences Centre and the University of Western Ontario, 12 healthy older adults, ages 70 to 83, took falodipine with either water or grapefruit juice. With grapefruit juice, the drug exposure was about 2.9 times higher, and the peak level was 4 times higher. In plain English, that is about 190% more total exposure, and roughly 300% higher peak levels. That is not a small number. Let me tell you about Patricia, 71, from San Diego. She loved a morning glass of grapefruit juice and took it with nearly everything because, in her words, juice helps it go down. One week, she felt oddly flushed and unsteady after taking her blood pressure medicine. Not every medication interacts with grapefruit, but enough do that you never want to guess. The consequence can be stronger side effects than you bargained for. Dizziness, low blood pressure, headache, heart rhythm concerns, or drug levels that simply go too high. So what should you do instead? Use plain water unless the label or your clinician specifically says otherwise. If you enjoy grapefruit, ask a pharmacist a focused question. Is grapefruit safe with any of my medicines? Do not assume some statins are affected. Some blood pressure medicines are affected. Some are not. This is a perfect example of why healthy food and safe with pills are not the same thing. Number 7. Taking certain pills at the wrong time with calcium, iron, or breakfast. Stay with me until the end, because this is the breakfast table mistake I promised you. Here's what most people get wrong. Calcium is good for bones, but it can be bad timing for some medicines. Here's what it does inside you. Think of calcium like a magnet or a parking clamp. When it grabs onto certain medicines, your body cannot absorb them the way it should. The pill arrives, but the loading dock is blocked. A study at Stony Brook University and Stony Brook University Hospital looked at 8 healthy adults and found that when levothyroxine, a common thyroid medicine, was taken with calcium preparations, absorption dropped by about 20 to 25%. 20 to 25%. That is not a small number. Let me tell you about Linda, 68, from Des Moines. Her thyroid numbers kept drifting in the wrong direction. Even though she swore she never missed a pill, she was telling the truth. The real problem was timing. She took her thyroid pill with breakfast, along with her calcium and multivitamin. Once we separated them, her labs improved without changing her commitment one bit. This does not only matter for thyroid medicine. Calcium and iron can interfere with other drugs too. Some medicines need to be taken alone, on an empty stomach, with water, and then left alone for a window of time. So what should you do instead if you take thyroid medicine? The usual safest habit is first thing in the morning, with water, by itself. Then wait before food, and keep calcium and iron hours away, unless your own doctor has given you a different plan. If mornings are chaotic, ask whether bedtime or another schedule makes sense for you. Read the label. Ask the pharmacist. Write the timing directly on the bottle if you need to. Synergy tip. This is where a written medicine schedule beats memory every time. Number 8. Ignoring, coughing, sticking, or the feeling that pills are just hard now. This last one may be the most important because it changes how you think. If pills suddenly feel larger than they used to, or you cough with them, or you need repeated swallows, or food seems to hang in your throat, do not brush it off as just getting older. Here's what it does inside you. This can be a sign of swallowing decline, also called dysphagia. Dysphagia simply means trouble swallowing. Think of it like the smoke alarm of the eating and swallowing system. The alarm is annoying. Yes, but the alarm is telling you something. A systematic review of 15 studies involving 9,947 people found that in higher quality studies, the average prevalence of dysphagia in older adults living in the community was about 15%. The review also linked swallowing trouble to dehydration, malnutrition, frailty, aspiration pneumonia, falls, and hospitalizations. Let that sink in. This is not a fussy complaint. This is a health marker. Let me tell you about George, 81, from Dayton. He kept saying, "It's nothing. I just have to wash pills down twice." Then his daughter noticed he was clearing his throat at dinner and avoiding dry foods like crackers and chicken breast. By the time he came in, he had lost weight and was tired all the time. A proper swallow evaluation changed the whole picture. Not overnight, but enough that he started eating with confidence again. The benefit of paying attention early is huge. Better nutrition, safer swallowing, fewer chest infections, fewer dangerous workarounds, less fear. So what should you do instead? If pills stick, if you cough while swallowing, if your voice sounds wet after drinking, if you avoid certain textures, if you have unexplained weight loss, or if swallowing simply feels harder than it did 6 months ago, bring it up. Ask about a swallowing evaluation. Ask whether speech therapy or medication changes would help. And pair that with number 3. Good technique matters. But technique is not a substitute for evaluation. When the warning signs are there, let's bring it all together. Number 1. Do not dry swallow. The hallway needs water. Number 2. Do not take pills lying down, or as your head hits the pillow. Gravity is part of the treatment. Number 3. Use the right technique for the right pill. Tablets behave differently from capsules. Number 4. Do not crush, split, or open pills on your own. The coding and release pattern matter. Number 5. Do not treat a long medication list like one single event. Timing matters. Pairing matters. Separation matters. Number 6. Do not assume juice is harmless. Water is the safest default, and grapefruit can make some medicines far stronger. Number 7. Do not bury certain pills under breakfast. Calcium or iron when they need space to absorb properly. Number 8. Do not ignore the warning signs of swallowing trouble. Coughing, sticking, throat clearing, repeated swallows. Those are clues, not nuisances. Transit, absorption, interaction. That is the whole story. Tonight, do this. 1. Move your pills off the nightstand if you take them in bed. 2. Place a full glass of water next to the medicines you take most often. 3. Check whether any of your pills are tablets and any are capsules, and use the right swallowing method for each. 4. Look at every bottle you crush, split or open, and make a note to ask your pharmacist if that is safe. 5. Write down any pill that must be taken alone, with food, or away from calcium or iron. 6. If you ever cough, choke, or feel pills sticking, put that symptom on paper and bring it to your next appointment. Better yet, call sooner. 7. If you take 5 or more medicines, schedule a medication review. Not someday, this week. I want to leave you with something more important than technique. Health after 65 is not just about living longer. It is about living with steadiness, with dignity, with enough strength to carry your own groceries, enough breath to laugh at the table, enough clarity to remember your grandchild's name in the middle of a noisy room, enough confidence to take the medicines you need without feeling like every dose is a gamble. That is why I care so much about details, like posture water, timing, and one little glass of juice. Because tiny habits become big outcomes. And because I have watched people reclaim confidence just by learning what no one ever bothered to explain, slowly. So if you have been doing this the risky way, do not panic. Do not feel ashamed. Just change the next dose. Then the one after that. Then the routine. It is never too late. If this helped you, subscribe, turn on the notification bell, and share this video with one person over 65 who takes medicine every day. And in the comments, tell me this. Which mistake surprised you most? And how many pills do you take in a typical day? I read every single comment.